Okay. Good afternoon. I'm Dr. Bukola Olutola from Independent Institute of Education, IIEMSA, in South Africa. I'll be presenting on the knowledge and awareness of cervical cancer, human papillomavirus, and the vaccine among students of a higher education institution in South Africa. My co-author is Keabetsoe Motuba. She is a student and I'm the supervisor for this study. Studies have shown that there are over 400 types of human papillomavirus, and human papillomavirus has been also shown reported by the WHO to account for 5% of all cancers. So that shows how serious it is, and every government or the organization, World Health Organization, should have every way of preventing it. So that is why we have human papillomavirus vaccine. And in South Africa, there has been an increased decline in public demand for it, and is likely linked to weakening social mobilization, inadequate reminder systems, and vaccine hesitancy, especially when people don't know the importance of the HPV vaccine. And also, if they don't know about HPV, the virus itself and how dangerous it is, in terms of causing cancer. So, young women in South Africa face a disproportionate burden of HPV and HIV co-infections, increasing their risk for early invasive cervical cancer. And this has made the government to introduce, in 2024, free vaccinations against HPV to girls, between, I think, 9 and 14 in the public schools through the integrated school health programs. However, HPV vaccine should also be given to boys. Some boys are taking it, the private hospitals or health institutions also, they give to boys, because early male vaccination against HPV is effective in the prevention of anogenital warts, penile, and anorectal cancer. So we can see that HPV vaccine shouldn't be for ladies or for girls alone, but also for boys. And this has this led to this research. So the aim of this research was to explore, the knowledge and awareness among male and female students of a higher education institution in South Africa, concerning cervical cancer, HPV, and the associated vaccine. So this is the methodology of the study. The study used a qualitative research approach, and ethics was obtained from the Public Health Ethics Committee of the IIEMSA. And the sampling used was convening sampling, which is a form of non-probability sampling. And semi-structured face-to-face interviews were conducted one-on-one, with each of the participants. There were 10 of them. 10 students participated in the study, answering some questions from the interview schedule. So after the interviews were transcribed and the data derived were analyzed using thematic data analysis. 3 teams came to, before the teams, this is the summary of the social demographics of the participants. Like, as I mentioned before, there were 10 participants, ranging their ages range from 19 to 24, and they came from different departments and also different levels of school. The first year, some of them were in the first year. Second year, some of them were doing their honors. This study was actually conducted last year in 2024. So if you look at the vaccination status of the students, only one of them said she was vaccinated. Even the ladies amongst them, the remaining 4 had not been vaccinated, did not receive the vaccine. And also the boys, they did not receive the vaccine. So this is the social demographics of the study, of the participants of the study. So from the thematic data analysis conducted, 3 themes came into being. We had the limited awareness of cervical cancer, HPV, and the vaccine, gaps in knowledge of cervical cancer, HPV, and the vaccine, and also the perceived barriers to vaccination. Concerning the limited awareness of cervical cancer, actually many students were aware of the vaccine's existence, but only few of them, those that were interviewed, only few understood its full benefit, including preventing various types of cancer associated with the virus, such as cervical cancers. They didn't know that it could prevent cervical cancer, talk less of anorectal or genital warts for men too. And there was also confusion about the target population for vaccination. Most of them did not know that a boy that could also get the vaccination, and also some of the students mistakenly believe that the age group during which the vaccine is most effective. They didn't know about the age group during which the vaccine is most effective. So there was limited awareness from the interview of cervical cancer, HPV, and the vaccine. Concerning gaps in knowledge, there was limited understanding of how HPV is transmitted. Some of them had not even heard about HPV before, and those who heard it before, they didn't know how it could be transmitted. In terms of maybe sexual contact, most people knew about HIV but not HPV, and they didn't also have a full understanding of the full spectrum of HPV-related cancer risk and the broader benefits of the vaccination, especially among males and older individuals. So, and some of the students also they had lack knowledge about the vaccine's effectiveness, safety, and the need for potential boosters. So you could see from even the number of people who had been vaccinated, out of the 10 students, only 1 of them had been vaccinated. So in terms of vaccine effectiveness, they did not know, and the safety, they were not sure about the safety of the HPV vaccine. So those are the things that came out from the study. And cultural stigma, misinformation, and disparities also came into being. So that is under knowledge. Now for the perceived barriers to vaccination, I call it perceived barriers because some of the barriers that they mentioned probably did not really exist, because some of the students use the private health facilities. So they were not really aware of the vaccine being in the public, for free. So they mentioned cost of the vaccine. They said they face barriers related to cost of vaccination and difficulty accessing vaccination services. So I still believe that is part of, although they call it barrier, that's their own perception, but it's still part of knowledge, because they don't really know what the government has, the provision of the government concerning the vaccine. So those are the 3 themes that came from the analysis of the study. So in conclusion, one of the things that came out was misinformation, like the perceived barrier to vaccination, and also the effectiveness and the safety, because they were not sure of the safety of the vaccine. Some of them probably did not have it, or maybe their parents, when they were smaller or younger, their parents did not give it to take them for the vaccine. So misinformation is a big problem, and the government has to look into it by giving the correct information, making the correct information available, maybe through media. The lack of awareness, that is also the work of the government through media, social media, or television, any form of media that the government can use, and also anxiety over the HPV vaccination in terms of the safety, because they were anxious, they were not sure whether it was safe or not. So thank you for the presentation, and this is the end of the presentation. Thank you.